Welcome to the Columbus Metropolitan Club. I'm Eddie Pauline, President and CEO of Ohio Life Sciences. We're the trade association for the life sciences industry here in Ohio. And I'm also proud to be a member of the CMC Board of Trustees. Thank you to the presenting sponsor of CMC's Optimal Health Series, the Ohio State University Wexner Medical Center, and Nationwide Children's Hospital. Appreciate that. Also, thank you to today's forum sponsors, the Community Shelter Board, Columbus Business First, and today's partner, the Grange Insurance Audubon Center, for hosting us. Thank you. We're also grateful to the Center for Human Kindness at the Columbus Foundation and the Columbus Dispatch for presenting today's live stream, which is being carried on CMC's social media platforms. Thank you again to all of our sponsors. Today's critical conversation is about the steps Ohio needs to take to end the stigma of substance abuse and mental illness. In the last few years, our nation has seen an increase in substance misuse, alcohol consumption, and depression. Here in Ohio, 1 in 13 people lives with addiction, and nearly 1 in 4 struggle with a mental health condition. As we mark Mental Health Awareness Month, it's my great honor to welcome today's speakers. Lori Chris serves as a director of the Ohio Department of Mental Health and Addiction Services and is a member of Governor DeWine's cabinet. Juliette Doris Williams, executive director of the Peer Center. Ariana Howitt, clinical director of On Our Sleeves and pediatric psychologist with Nationwide Children's Hospital. And Chad Jester, who asked if I could provide a joke about him or jab him in some way, but I'm lost in a way to do that, so feel free to do that after the forum today. Chad serves as Vice President of Corporate Citizenship and President of the Nationwide Foundation. And our host, Greg Moody, Director of Professional Development for the John Glenn School of Public Affairs at the Ohio State University. John Glenn College. That was a big deal when it became a college, so Greg, apologize for that. You can read more about today's speakers in your forum flyers. Greg, we look forward to today's conversation. Thank you.
Thank you, and thank you to our panelists. Ohio was already confronting an epidemic before there was a pandemic. 6 years ago, in 2017, drug overdose deaths in Ohio were more than double the national average. Communities across the state mobilized and made progress. Overdose deaths dropped 25% in 2018 and stayed at that lower level until COVID hit in 2020. What we experienced during COVID, isolation, anxiety, disruption, financial strain, these are warning signs for mental health and addiction. The public health emergency related to COVID officially ends tomorrow, but work continues to deal with the aftermath and the ongoing epidemic of addiction in Ohio. One difference today compared to 10 years ago, certainly 20 years ago, is that we can talk openly about addiction and mental illness. Many of you in this room have worked to reduce stigma. Our panelists certainly have, and set the stage for direct conversation about how to end suffering from mental illness and addiction. So let's start today's conversation. I would ask the panelists, please reintroduce yourself and your organization. And I know each of you are passionate about what you do. What drives your passion for this work? Director?
Well, good afternoon, everyone. I'm Lori Chris. I'm director of the Ohio Department of Mental Health and Drug Addiction Services and a cabinet member for Governor Mike DeWine. And so what that means, though, is that I'm in the position to lead the organization that runs mental health and addiction services for the state of Ohio, that we actually provide care in state hospitals, in our prison system, in the state pharmacy as well, and some community services. But we also help with assessing need, planning for, and financing services in communities throughout the state of Ohio. So lots of important work there. And it's prevention, helping people prevent mental illness, prevent substance use disorders, harm reduction, so helping people understand the illnesses themselves and become motivated and have the capacity to move into treatment. But ultimately, what we're aiming for is helping people thrive. So people with mental illness and substance use disorders want the same things that all of us want. They want health, physical, emotional, financial, spiritual, relationships. They want a safe place to live, and they want something to wake up for each day with purpose and meaning and goals that they're setting and being supported in. And the last thing I would say is they want a community who understands them, accepts them, and helps them live up, as Governor DeWine would say, to their full God-given potential. And so that's why I do what I do, and I've been doing it for over 30 years. I truly believe that we have a responsibility to honor the authentic purpose of every single human being. And for me, I've been a 30-year ally of people living with and recovering from mental illness and substance use disorders, and that's why I do what I do.
Good afternoon. I'm Juliette Doris Williams. I'm the Executive Director of the Peer Center, which is a drop-in recovery, wellness, and support center for people living with mental health, addiction, and trauma. Operating in 2 locations here in Columbus, Ohio. We also operate a daily warm line. We're open every day, 365 days, including all holidays. What drives me, what drives this work for me is what I was looking at my bio, and the thing that is not there is that I am a person who struggles with depression, anxiety. I'm a childhood and adult trauma survivor. And this work allows me to, 1, be the person that I needed when I was struggling heavily. 2, it allows me to create an environment and sustain an environment where others like me can come to receive the help, hope, and support that they need while they struggle.
Hi everyone, I'm Dr. Ariana Howitt. I am the clinical director of On Our Sleeves and a pediatric psychologist at Nationwide Children's Hospital. So what On Our Sleeves is our mission is to give free evidence-informed resources to every community in the U.S. to help increase the understanding and to promote mental health and wellness of all children. And why I do this work, especially as a psychologist, is I find it so important that we reach the people that need us the most with the science. In our field, we know what helps. We know the things that, the tools and habits that kids need to promote their mental wellness, and I'm proud to be a part of On Our Sleeves and getting that information out to everyone. And one way I like to highlight that is to ask you all a question. How many of you all, with the job that you do right now, went through extensive education, training, orientation to know how to do what you do? Raise your hands. Yeah, so most of us, right? But when it comes to parenting, we don't get that. There's no manual, there's no orientation. You get this baby, you take it home, and good luck. And so that's what On Our Sleeves is here to do, is to give those resources and that education and information that we need, not just as parents and caregivers, but teachers, coaches, any adult that has a child in their life.
Hi, I'm Chad Jester from Nationwide, the Nationwide Foundation. So in our work tied to mental health and addiction issues, I'd layer it out why I'm passionate and why I care about this. First and foremost, I work for an organization that's been focused on these issues for a long, long time, supporting our employees and their families. Actually, our head of health and wellness is here to make sure that I made that plug. But it's been significant work supporting nationwide families. And when we started benchmarking other companies, we found that there was opportunity to share with others what we're doing in the private sector and how they can adopt some of our work. And actually, our team offered to do that for free to others. Secondly, when the epidemic, as well said, was facing Ohio tied to opioids, We decided as a corporate citizen and an engaged company to be engaged in that work. We worked with Adam H. of Franklin County to support a PSA campaign that Adam H. was calling for tied to opioids. And in 2018, we did the Denial Ohio campaign. So Nationwide is behind that. It's not branded purposefully, but our foundation did some of the initial funding with public-private support. We got a lot of members involved with the Ohio Opioid Education Alliance because we wanted it to be community-wide and have all engaged parties involved with the work. So the way I think about it today is, one, what are we doing for the betterment of humanity? For our community and Ohioans, and I think Lori said that extremely well. Actually, Lori was involved with our work before she was Director Chris in her prior role. Secondly, then, let's not sit on the sidelines. Let's be engaged and try to move the work forward with the Beat the Stigma campaign that we're currently running, and you're going to see a new ad today on mental health that you'll be the first audience to see that. We want this to be an engaged forum within Ohio where we're all embracing the fact that mental health and substance misuse are illnesses. And we need to show empathy to those who we work with and those in our community, those who we may not know are suffering, but understand that a lot of people are suffering. Finally, I would say from a passion standpoint, my family's been impacted. I'm not going to ask for the show of hands, but my guess is many of you in the room have also had loved ones who've been impacted by mental health and substance misuse. My family is one of those. And as you learn more and engage more, my experience has been, and my hope is, that we're all talking about these issues much more overtly and transparently than what we have in the past.
Thank you. Chad, you mentioned the spot. Do you want to go ahead and introduce that, and we'll...
Go ahead and do the spot. So what we've done with the Alliance is a framework of member organizations from public sector, private sector, education, nonprofit communities supporting a public service announcement campaign and activating it. So the Beat the Stigma campaign is, again, the second PSA campaign that we've done. Denial Ohio was the first. And it is really driven by the state of Ohio's leadership. So Governor DeWine's passion around mental health and substance misuse is transparent, overt, and very passionate. But then he went a step further and came to us and said, can you guys do a campaign, which turned out to be Beat the Stigma, and the state's invested a lot of money in it, so we can bring this to all 88 counties within Ohio. Substance misuse and mental health are complex issues. Right? The professionals here know much better than I. Our marketing team, some of whom are here today, utilize their talents, our agency talents, to do the research and put the campaign together, all the creative. So in the creative you've seen so far, I would call out that we did focus groups. And Ohioans do say things like, well, that person has a substance misuse issue because they are hanging out with the wrong person, made the wrong choices, all the things that are stereotypes, right, and stigmas. So we took the research, which I thought was brilliant from our advertising team, and put it in the ads, right, in a game show format to call out the ridiculousness of how people are thinking sometimes about these issues. The other thing is I see Dr. Schutz-Reinhardt nodding and smiling. She's with Ohio State. We all wanted to make sure that we're holding ourselves accountable for the performance of this campaign. Dr. Schutz-Reinhardt's part of the team doing the research on it. So we know two things about the campaign. One, it's needed, and secondly, it's working, right? So her research is showing we're having a high impact. First ad you will see is the substance misuse ad. So we're going to show that. The second ad is brand new. You're the first to see it, mental health ad that'll start airing more robustly this year. 150 organizations around the state of Ohio, public, private, nonprofit, education sector, and most of the sports teams in Ohio. So Kristen Ross on our team. Kristen, if you could raise your hand. Don't take that bite. Raise your hand first. Kristen essentially serving as executive director of the Ohio Opioid Education Alliance. So we are stretching throughout the state of Ohio to bring more members on. And the professional sports teams who we have on are playing the ads during games. I mean, it's a really cool thing to reach as many Ohioans as we can. But let me just prompt with this audience, if you want to be involved with the Alliance as a member, have folks you can connect us with, we're growing organically all the time. So please let us know, but Kristen is the point of contact there.
Welcome back to Beat the Stigma. Contestants, someone tells you they've been living with anxiety or depression. You say, Ben.
Just snap out of it.
What? Maddie?
You have no reason to be depressed.
That's actually harmful.
I'll push through it.
No.
Everyone gets sad sometimes.
No.
Come on, you don't have it that bad.
No. But let's see what you can say. I'm here for you. You're not alone. Talking to someone could help.
That was close.
Not even remotely. You did not beat the stigma.
So, Lori, if I could prompt something to Lori real quick. You know, again, it's all research-based, but our marketing team and focus groups heard those responses, and we put them in the ads, right? Some of the brilliance of the creative. But, Lori, some folks we've heard from are surprised by the family history ties to mental health and addiction services. If you don't mind, if I could ask a question of a fellow panelist, I think it'd be great for Lori to share thoughts on that.
Yeah, so a couple of things. I want to talk about that, and I also want to talk about why these ads matter too. There are known reasons that some people use substances and it progresses into misuse, abuse, or a dangerous or deadly dependency and addiction, and others don't. And family history is one of those key indicators. So we know specifically with substance use disorder that there are genetic links between a family member who has it and then future generations or other family members having substance use disorder. And so when we think of policies that we make in the public sector, there's a reason why the drinking age is 21. It's because the longer a person delays the onset of use, the less likely they are to have a substance use disorder. We know more about the brain today than we did when 21 was chosen. So that might have been 25 or 26 if we had known then what we know now. But the fact is there's science behind the policies and the practices that are put in place. The other thing that we know is that, and this was a priority that was given to us by the Recovery Ohio Advisory Board, Recovery Ohio being the first executive order that Governor DeWine put in place when he was sworn into office in 2019. And it was to aggressively pursue strategies that would help end the opiate crisis, but also the mental health crisis in Ohio. And we have some Recovery Ohio board members here today, so I know Julie's here. And Director Shadwick's here as well. There are reasons why people don't get care. Not knowing where to go is one of them. They're just simply, until recently, when Nationwide Children's put behavioral health pavilion on the side of their building on I-70, we saw heart hospitals, eye institutes, cancer hospitals. We never saw behavioral health wide and loud for people to easily identify it. People also don't know how to pay for it. They're not sure if their insurance is going to pay for it. They're very concerned about that. They're afraid they'll lose control. They've seen movies or TV shows where they're locked away for 30 days or forced to take medication. So that's a very intimidating experience. They don't know what treatment looks like. But the number one reason is stigma. And stigma is more than just misunderstanding or harmful words or negative attitudes. It actually causes people to feel shame, and that shame prevents them from acknowledging that they need help and then seeking that help. And so this was the top priority for the Recovery Ohio Advisory Council, and it's one that we were happy to, with the governor's direction, really partner with the Opioid Education Alliance, the Franklin County Adam Board, I see Erica here, and make sure that it became available on all 88 counties so people know it's okay not to be okay, it's okay to ask for help, know how to talk to each other about these things, what not to say, as the ad points out, and then there's a website, too, that points people to actions where they can seek help and pursue those resources.
Thank you. There's a long history of activity in this space. Where are we right now? How are Ohioans doing right now? And what are some of the things you're seeing that concern you most? Juliet, do you want to pick up from that?
So the things that concern me most now is that collectively, when I say collectively, I'm talking about humanity, is that we are maybe on the other side of COVID, but we don't talk about 1.5 million people dead in our country. We don't talk about the fact that we who are here have survived and have been traumatized. by this societal, this huge global event that happened. And we're carrying on our lives as if that thing didn't happen. And so go downstream a bit for folks who are housing insecure, food insecure, people jobless or underemployed. And those kinds of stresses or stressors that happened during the pandemic, those things they were bad before, they're worse now. And so people don't know where to go. They don't know who to call. It seems like the world is, back to normal, whatever that means. And normal wasn't good. Normal wasn't good anyway. And we've backtracked on all the things that the society needed to shore us up. And that concerns me. And I see these folks every day because they make their way into our centers because we're a drop-in, we're open door. And people if they were hopeless before, where are they now? And so trying to rally people to have some hope, it's hard now, harder.
We know similar things when it comes to children's mental health, is that pre-pandemic, the CDC had released numbers that they collected from 2009 to 2019, and we were already seeing concerning trends, increases in depression, anxiety, suicidal thoughts and behaviors. And then the pandemic happened, where we saw kids' lives completely disrupted, increased isolation. They're impacted by what the adults are going through, the financial concerns, the health, the family members dying. And so, of course, it made the trends we were seeing worse. And so, again, while we may be past the pandemic, the kids are still figuring things out. I heard a lot from my patients when schools opened up again, this fear. I don't know how to talk to my peers anymore. I haven't done it in years. And so it's having to navigate and readjust again to something different, which they have already done multiple times in their few years of life. And so the hope for me is that at least we are now more aware of children's mental health. Speaking to the stigma, people are more comfortable talking about it. We do realize that kids do experience things like depression and anxiety. And that we saw a shift in that. And on our sleeves, we initially started to bring attention to this, 1 in 5 kids is living with a mental health disorder. But people are aware now. And the families that we talk to, they know, they're worried, and they're asking for the resources. And that makes me hopeful that people are motivated to take action now because of everything we've been through.
That most of us wouldn't know is that 19 people die every day in Ohio from suicide and overdose death. And when you look at the emergency room use of people that actually whose lives were saved and they were in those experiences, the numbers are much higher, and into the thousands on a monthly basis. And one of the things we've done in Ohio last July, we started 988, the new 3-digit number for Ohioans to call if they need psychiatric or addiction crisis help. This is not like 911 where someone will drive out to your house and help you, or into the community. This is a consultation, time for the person or their family to talk with someone and get guidance on what they can do to feel better, and then what they need to do next to continue feeling better. They'll also assess if there's lethality for potential suicide or hurting themselves or hurting someone else, and they will connect to law enforcement if necessary. But the ultimate goal is to start this conversation more easily, more visibly, in a way that makes sense to the person, and then to keep them engaged so that they can thrive. They can find places like the Peer Center. They can get connected to the things that will help them recover for the long haul.
I'd also add that we're looking at these issues as workforce issues. So I think Director Chris and Julia talked about supporting people so they can be engaged in the workforce and overcoming a stigma, right? So stigmas can prevent you from seeking the support and assistance that you need. But we want people to thrive, to use your phrasing, Lori, and we want people to be gainfully employed if they're able to be. The converse of that is folks who are gainfully employed in all of our institutions, public, private, nonprofit, government sector. How are we supporting our people? Right, so there have been a lot of struggles. Juliet called that out quite well. And employers are tuning in to what's going on with their employees and their families and the struggles that they may be going through with substance misuse or mental health. I'm thankful for the work that Nationwide does in that regard. And we have a lot of conversation about it inside the company, which has helped us all be more transparent with each other. It's actually pretty amazing, some of the dialogues that we've had. But one tool that we're using now is from Nationwide Children's called Bloom. And Dr. Hoet, maybe you can tell us more about that.
Absolutely. So we, in 2021, and then again last year in 2022, with generous Nationwide Foundation funding, we were able to conduct some surveys and focus groups with working parents and caregivers. And you have this at your table that gives you a little bit of a summary of what we found. But not surprisingly, you know, this was post-pandemic, 6 in 10 parents were concerned about their children's mental health. What I found really important as a psychologist is the information of, okay, yes, parents are concerned, but half of those parents were saying, I'm missing a day of work a month or more because of my child's mental health. And the parents that are coming, that are not missing work, they're not mentally present. They're having a hard time focusing. And what we found with our survey last year is that families, working parents and caregivers, they don't feel comfortable talking about it at work. That stigma comes up. They don't feel comfortable talking about it to their colleagues, their bosses, HR. And so they're leaving. They're leaving the workforce when they have to choose between their family and their children. And work, they're choosing their family. And we saw those numbers at even higher rates for working parents of diverse backgrounds. And so one of the things that really jumped out from that survey is we asked the working parents, if you were to have a wellness benefit from your employer that was for your physical health, for your mental health, or for your child's mental health, which one would you prefer? And most parents said, I want something about my child's mental health. And they told us it would make me feel more valued as an employee if I had that. So we created that. We have Bloom, and again, you have some information about Bloom at your table. It is a wonderful resource. So it's a digital curriculum that parents can log on, and it'll ask them a set of questions, 3 to 5 questions, and depending how they answer, they'll be put in 3 tracks. They'll get the Flourish content, which is information to help your child develop healthy. What are those habits that you can promote in your child so that they are mentally healthy? We have the Manage track, which is for families who are managing a child with a mental health diagnosis. How do they balance work and therapy? How do they support their child? And then we have the track for families that may be in crisis. How do I support my child that's in crisis? How do I seek immediate help? And so it's a great benefit that employers can provide to their employees, and we hear from them that this helps them want to stay around, this helps them feel supported, and we also hear that it is changing their behaviors as a parent once they go through our Bloom resource, so we know it's working.
I'm so impressed with that work. It's really helping to drive the conversation. And one of the things that can be really intimidating about talking about mental health and substance use disorders is being afraid of saying the wrong thing or asking the wrong question and making it worse. And so tools like that are really helpful for families. We are working with the Ohio Suicide Prevention Foundation and just help them release an employer toolkit. So it makes it easier, just a bit of a roadmap, some guidance questions for employers to think about, what am I doing in my environment that's making it okay or not okay for someone to call in sick because they need mental health support or because a family member does. And more practical guidance too, and looking at their insurance benefits and more. So that's available on our website, and we can certainly share that with the CMC so that can be more available to all of you as well. But knowing what to say and what not to say can really help reduce some of that anxiety that any of us might feel. And I get a lot of calls. I'm really grateful for 988 for that reason too, because now I can point people to professional help. But I get a lot of calls at home, and they're usually things like, their son has a challenge. They don't want to tell the school because they don't want it to interfere with his relationships there. They don't know even what to say to their pediatrician. And a lot of it isn't, it's more about shame than anything else, and embarrassment, right? How did this happen to my kid? And trying to put it in terms of what would you do if you found, God forbid, a lump on your child's neck? You would not be ashamed. What would you do if your son or daughter had a broken leg? Kids would visit, they'd sign the cast, everybody would rally around, people might even make you meals and bring it to your home. That does not happen yet with mental health and substance use disorders, but that's the path we're on when we get rid of stigma and we make it more possible for people to talk to each other and to normalize really supportive, positive behaviors instead of that isolation, which really just helps keep people sick. I don't want to make you say anything.
She pointed to me, so I guess I gotta say something. The one thing that, and I will not be able to leave this forum without talking about our social media campaign. So write down #MH2 because we launched, the Peer Center launched a social media campaign to change some of those attitudes and about what recovery looks like. When every table that I have sat at, and a little bit of table pounding there happening, where people would talk about recovery, and they would talk about recovery from the addiction point of view. And I'm a mental health person, so I'm curious about that. So and it was consistent across all systems. Every table that I found, every meeting that I was in, I was invited to be interviewed on news shows, and I'm going, what is happening? And so finally, instead of being frustrated and angry at people, I decided to do something about it. So we created this campaign where we talk about mental health from a recovery standpoint. And so mental health too, as in also. We live in recovery. The same wellness tools that are employed on the addiction side are also employed on the mental health side. Yes, treatments and medications and all of the strategies may be different from the addiction, alcohol, drugs, and gambling, we cannot forget, and all the other addictions may be different at the different approaches when you're talking about mental health, but living well, living whole, getting us some healing, that's recovery, and it happens across the board on both sides of that equation. So I was happy. Lori talked me down earlier. Just wanted me to see that ad because I was, as a member of the Recovery Ohio Advisory Council, the first thing, when the first ad came out, I was the one that said, where's the mental health stuff? Where's that? Because that plan, that massive plan that we created, also is mental health and addiction. And so thank you. So
We listened.
Yes. I can stop pounding the table now. That's the message that I want all of us to go away with, is that recovery happens, and we live, we love, we pray, we worship, we play, and we thrive in recovery too. So whether it's addiction, whether it's mental health, I'm hoping that we'll be more inclusive going forward when we're talking about recovery, so that we're talking about all the entire landscape.
Thank you. Well, and this prompts so many questions, and we'll move to questions from our live stream and in-person audience in just a few minutes. If you have a question, please make your way to the microphone now. If you're watching online, please type your questions into the chat. Before we take audience questions, though, I have one final question for the panelists. We've talked a lot about what has brought us to this moment. What comes next? What happens over the next 6 months that folks should be looking for, opportunities to get involved, the things you think are going to be most critical to shaping this issue going forward?
Want me to start? I can start. So don't leave here today with thinking that this was just a lovely event to learn a little bit more. Please feel this as a call to action, whether that's in your own home, in your neighborhood, in your community, in your church community. We have started a conversation. I talked about it as movement earlier when Juliet and I were talking, where it's no longer in the shadows. But we have to actually put the resources together to make sure that now people feel okay to ask for help, that help is available. So we have workforce initiatives underway. The behavioral health workforce is woefully inadequate, and we need to invite people into this and help them feel valued, and that's one of the governor's primary goals. But I will also say our department works at the statewide level. We partner with 50 alcohol, drug, and mental health boards, and I'll call out again, Franklin County ADAMH Board is here. Support them in their efforts. They're leading community planning processes, implementation processes, levy campaigns. They contribute $400 million to the solution in addition to the state and federal resources that come here and the private foundation resources. Get involved at the local level. We can do a lot at the state level from a policy and technical assistance and resource perspective, but all change is local, and you have the opportunity to contribute to that.
Follow that by just making the observation that we've covered a lot of positive ground in recent years. So I feel like the momentum is going in the right direction. The only way we've gotten to that point is by all of us taking accountability for these challenging issues. So we can't sit back and say, well, Director Chris, she's got it, right? State of Ohio, it's their issue. Or even say to Erica Clark-Jones and her team in Franklin County, it's their issue. It can't be left to just one aspect or element of our society. We all have to take that accountability. So for all of us in the room, go back to your employer and have this conversation with your employer. And my colleague Tina Thornton is looking at me going, yes, Chad, tell them to do that. We all need health and wellness aspects within the workforce, and our employers are a big part of that. So if we're hearing from Dr. Howitt, we're hearing from Juliet, and we're hearing from Director Chris at the state level, and from our employer, right, it's going to keep this trajectory going in a very positive way. It can't just be a statewide PSA campaign leading it. We've got to have connectivity throughout the state of Ohio, which really gets down to your household. So if, like my family, your family might have family histories tied to mental health or substance misuse, be proactive and talk to the younger generations in your family. Let them know about their risk. We've done that in our family, and it really opens up the door for very honest, transparent, difficult sometimes conversations.
I'll jump in and I'll say I agree. It takes all of us, and I'm grateful that children were included in the conversation today, and I hope that we continue to include them in the conversation. To Lori's point, a lot of the times families tell us they don't know how to talk about mental health, but kids are way ahead of us. They're talking about it. I've had patients bring their friend to therapy with them, which is always a little bit surprising. So there is less of a stigma in the younger generation, and they're talking about it, and they're using words that adults don't know. So we have to stay involved and up to date and continue to learn and reach out to On Our Sleeves so that we can continue to give children a voice and include them in this conversation.
I would like to put a plug in for the adults that are the grown-up children that did not have access to these systems of care that we're currently implementing. There's, as I'm an executive director of a nonprofit, so we're always looking for funding, right? Because what we do. And there's a dearth of funding opportunities. There's a dearth of grantors that want to help adults. Yeah, I'm looking at the people here. So adults are struggling out here, and they need that support. and organizations that focus on adults, do not forget them in your philanthropic efforts. Please do not forget that they need your support too.
I want to add one thing. We're talking about this as if it's happening to other people, but with 53% of employees saying that they are missing work for their child's mental health issues, the U.S. Surgeon General did a survey, and 76% of the workforce said that they have a symptom of a mental health condition at least once a month. It's happening in this room too, right? And so I want to just think about that as well. There are some very specific things that each of us can do today and every day. The first is stay connected to human beings. Reach out to people, ask them how they are. They will start reciprocating, not like, how's your anxiety today, Juliet? You know, just like, hey, did you go to any movies lately, right? Just like human, normal connection. Did you eat? Yeah, that was getting to that. The second one is also disconnect, right? Science tells us that spending time meditating, praying, breathing, being in nature, this will elevate our mood and improve our mental health. So connect, but also disconnect, unplug from that social media. It is there for our convenience, not for our consumption constantly. The other thing is to truly get outside, fresh air, 15 minutes a day. It's Mental Health Awareness Month. One of the things that we have underway is a partnership with Parks and Department of Natural Resources. Thrive outside, 15 minutes a day will help. And then also make sure you're taking care of your sleep and your eating and your physical health. It has a big impact on your mental health. But if there's one thing I would urge you to do to help prevent substance use disorders among kids, it would be to eat with your family every day. Every day have a meal together. I'm not saying you have to cook for your family. I don't care what you eat. I'm just saying you have to be together and eat, and not in a car, at a table, sharing a meal, sharing a conversation, checking in with one another. It is one of the best protective factors you can build in your family, is to have that connection, and it models for them how to have connection outside of the home too. This will help all of us.
Thank you, Director, and gathering like this. So thank you all for gathering. As you know, it's CMC's longstanding tradition to take audience questions. Sophia Pfiffner with CMC is curating questions from today's live stream audience, and for those of you with us in person, you can join her at the microphone. Out of respect for others, please keep your questions brief. Sophia, the first question.
Great, thank you so much. This question comes from our live stream, and the question is, when it comes to substance addiction and mental health illnesses, what are some of the challenges unique to the LGBTQIA+ community, and what are opportunities that folks in the room, as well as those who are watching from our live stream, can do to support them?
And to get as many questions in, we'll go quick question, quick response.
Sure, I can share a little bit. Thinking about kids of the LGBTQ community, we think about this idea of belonging. The Surgeon General just came out talking about isolation and loneliness in children, or in all of us, children and adults. And so it's all about helping children feel like they're important, like they belong. And so ways to support them in their schools, in their homes, finding that community, again, that connection is one of the best things that we can do, is helping kids feel seen and important and like they belong.
Next question.
My name is Brian Urbanski, and my wife and I have been affordable housing providers in the Columbus area for 20 years. And as a result of the affordable housing crisis we have in Columbus, we established the nonprofit Aubrey Affordable Housing Foundation, and our focus is on serving the justice-involved community, particularly those returning home after incarceration. And I really appreciate this discussion on stigma, because our residents face that every day in the workplace. And the vast majority of our residents had or have substance use disorders and behavioral health concerns. So I was wondering if any of the members of the panel can talk about specific resources available to this vulnerable population, particularly those without insurance coverage.
I think that's me. So our department and the Department of Rehabilitation and Corrections has a number of initiatives and resources underway for adults who are criminal justice involved and have behavioral health conditions. And we're partnering with youth services as well, because we know that youth and transition age youth need that similar kind of support. The budget that Governor DeWine has proposed now that's moving through the General Assembly includes additional resources for access to housing and access to employment opportunities and supports, and not just transitional or one-time rent payments, but for people who need that longer support and choice in their housing environments too. So permanent supportive housing, group environments, and also recovery housing, creating options and those financing supports that go along with it.
Thank you.
Also, I'd like to speak to that a little bit. In terms of a local resource, the Peer Center, we are very intentional about hiring people with lived experience of mental health, addiction, and trauma. We're very intentional about that. In fact, 100% of us, 30 so far, 100% of us are people with those lived experiences. And with those lived experiences also come histories of incarceration, histories of homelessness, name it, we've got it represented on our staff. And so we're an open door. Drop in, open door, no appointments needed, free, because nonprofit, hello. And so please send folks to us. So thanks.
Hi, my name is Karen Twynham. I am the support group leader of Loving Someone with Mental Illness, and I work with families that are dealing with schizophrenia and severe bipolar disorder and severe depression, people who are probably not going to recover. My group doesn't see a lot of momentum and doesn't see a lot of hope. I wanted to ask you, Lori, in particular, you had talked about permanent supportive housing a moment ago. My son is on the schizophrenia spectrum. He was on the waiting list for permanent supportive housing for 3 years. That was 10 years ago. The waiting list for permanent supportive housing is still 3 years. What is the governor planning to do, or your department planning to do, to help people and families who are dealing with schizophrenia and severe and persistent mental illness?
Thank you for the question, and I'd be happy to talk with you afterwards if we have, and if there's a way for us to provide direct connection and support for you and your son. There's a lot of work underway from our department. Our department is primarily responsible for linking people to services and supports that exist in other systems, but that collaboration is a top priority for Governor DeWine, making sure we're working together and not against each other. And so sometimes what happens is people don't meet the criteria for the vouchers that are available because a lot of that's defined at the federal level. Our department has started to put into place resources that don't rely on those federal definitions. An example of that is some access to wellness money that doesn't look at HUD's definition of homelessness or the VA's definition of homelessness based on honorary discharge and other factors as two examples. So we have resources that we're working with the ATOM boards to help with that. Part of the issue is helping people navigate to the right spot, and I'd be happy to help with that.
I'm John Lowe. I'm interested in the comments about an inherited factor, genetics. Lots of things run in families, and lots of things were assumed to be genetic, therefore, and it's often not true. I'm wondering is there physical evidence that there is something physically different passed on from one generation to another related to alcohol and or drug abuse?
Yes, there is research that shows that with substance use disorders specifically, there can be a genetic link that is related to generational patterns of substance use disorder, both alcohol and drugs.
What is it, if I may ask?
So I don't have the reference top of mind, but I'd be happy to connect with you after this. And I know there are some friends here from addiction treatment programs at Ohio State that probably have that top of mind more than I do right in this moment too, that can help as well.
Good afternoon. My name is Susan Boudry. I work with the Osteopathic Heritage Foundations, and thank you all for your leadership on this topic. Laura, I was wondering if you could just share a little bit more about strategies to address the workforce issues. We know that the demand for services is growing exponentially, but the number of clinicians entering the field is not. So what's kind of happening from a statewide perspective on how to address that gap?
Sure. So historically, there have been workforce efforts, but there hasn't been a cohesive strategy. So there might be one-off investments here and there. We're working right now to pull together a strategy that isn't just from our department, because our expertise is in mental health and addiction, not in employment and education. So working with the Department of Education, Higher Education, Jobs and Family Services to create pathways into careers that include mental health and addiction, and really see us as part of healthcare and STEM careers, and start helping pipelines from middle school and high school into this work. But also people who are working in other sectors that might be drawn to this work also coming in as well. Part of that is apprenticeships that will be paid for, paid internships and scholarship opportunities for students. And part of that is also related to better payment rates for provider organizations so that they can pay the salaries that will help keep people in the workforce. So lots of different work going on. Happy to talk more if you're interested.
We're at time, but we're going to take time for one last quick question.
And I'm really sorry that this is the last question because we've received so many online, and I feel like this panel I could listen to this conversation for 8 hours if I had 8 hours. I'm sure all of you would like to stay for 8 hours. All right, the last question from online is, mental health and gun violence is in the news daily. The New York subway incident has some analysts saying we need more state hospital custodial care. What are the panel's thoughts on this recommendation?
I talked about this in my opening remarks. People with mental illness and substance use disorders want the same things that all of us do, and none of us want to be locked away. And so our goal is to make sure that acute care is available for kids, for adults, just like in physical health care, so that we can get that support when we need it, and that there's also outpatient services and other recovery supports, appropriate housing environments that are supportive, and that families get that full continuum, and that it gets paid for in a way that healthcare gets paid for. Create that full continuum so that locking people into a hospital or a prison or a jail doesn't become the default for people with mental illness and addiction. So we're working on that right now. Expanding hospital capacity is work that we're doing, but also expanding that community support capacity too.
Well, I do wish we had more time, but I did just get the wrap-up signal. So we'll turn it back over to Eddie Pauline for concluding remarks.
All right, thanks everyone. We hope you found today's forum very informative, fulfilling, and gives you some inspiration to think about some important things throughout the rest of today and in the weeks ahead. Thank you again to CMC's Optimal Health Series presenting sponsors, The Ohio State University Wexner Medical Center and Nationwide Children's Hospital. Thank you again to today's sponsors, the Community Shelter Board, Columbus Business First, and our partner, the Grange Insurance Auto Bond Center. Lastly, we are grateful for our virtual seat patrons and to the Center for Human Kindness and the Columbus Foundation and the Columbus Dispatch for supporting today's live stream. And our very special appreciation for today's speakers, Lori Chris, Juliet Doris Williams, Ariana Howitt, Chad Jester, and our host, Greg Moody. Thank you. Finally, please make plans now to attend next Wednesday's forum, Regional Mayors Prepare for Intel, right here at the Grange Insurance Autobahn Center. And please take a moment to answer the short survey that's in your forum flyers. Thank you again. Have a good week.